I'm going to show you how we do these intra-articular knee injections. It's pretty simple. I've used so many of these that I'm pretty adept at finding the right space and getting the needle in the right place without causing a lot of pain. But I will tell you that I'm a big wimp when it comes to pain and needles. I go slow. I'm not very stoic. I'm not very brave. So as much as I don't mind putting needles into other people, I don't like getting them in myself at all. So and that's probably a good thing, because then I'm more kind and careful and try to make it as, I assume everybody's got the same issues I do, so I go the extra mile to try to make it comfortable for people. But the first thing I do is I just make a little mark where I'm going to go. You can either do a lateral approach or medial approach. I usually do the medial. I'm right-handed, so it's easier for me to shoot this way than left-handed this way. I could do it this way, but I will go here. So I actually like the lateral approach a little bit better, but when I'm treating my left knee and do the medial approach, I just make a little mark on the skin where I'm going to go under the kneecap. And I think right about here is pretty good. So I just make a mark with my top of my needle. The right knee, I do over on this side. Make a little mark where I'm going to go. Right here. Okay. Then, let's see, I'm going to put on some gloves. And what we'll do, as soon as I get started, because I go so slow, we'll break it up into like time-lapse video, because that way I go slow, and that takes a lot of time. We'll speed it up for you. But at least I'm getting started here, telling you what I'm going to do. Put some gloves on here. And we're going to clean the area. Pesky here. A little bit of betadine to kill the bacteria. Okay, now what's next? Now we do a little bit of lidocaine. Christy's going to spray a little cold spray on there for me. Just one moment. Spray with a little gauze. And you're probably having a hard time finding that marking. Where is it? All right, I'll let you spray. Are you sure? Oh, right there, I can see. Is that it? All right. So we'll go ahead and spray that for 10 seconds. You can let go. Do a little bit of lidocaine here. Nice and slow. You might want to shoot this one from straight ahead. I don't know if they can see the needle, or they can. All right, I'm going slow. Why? Because I'm a wimp, and the slower you go, the less painful it is. So I'm just kind of creating a little bleb on the skin. And I'll go a little bit deeper. And I'm going to go slow. I'm really not feeling much pain at all. I can barely feel it, if at all. And I probably put more lidocaine in there than I need because, again, I'm a wimp. Okay, right there, I think. Oh, you found the spot? Where's the spot there? You see it? Okay, that's good. Keep going, stop. So when we use that cold spray on the skin, by the way, you don't feel the needle even going through the skin. So the only thing you'll feel is the lidocaine going in, which can cause a little pinching or burning, but it's not that bad, really. Even for me. Put a little bit deeper layers. Good. So that's enough of the lidocaine. Then actually I switched to ropivacaine. Why do I switch to ropivacaine on the inside of the joint? Because ropivacaine, one of the local anesthetics that we can use is less caustic to stem cells on the intra-articular portion. It's just better for the joint. And so even though we're not actually putting stem cells in there, it's still better for the joint. Less caustic, I guess is the best word to use, than the lidocaine. So that's what we use ropivacaine whenever we go into joint spaces. So now I'm just going to introduce this needle, and I'm just injecting more of the ropivacaine. And what I'm trying to do is get this needle into the joint space, which is approaching. And I'm putting this in here. I'm in the joint space now. That slipped in really easily. There's the hyaluronic acid. Ideally, you're doing them about, once a year, every 6 months. When I can remember to do them, I don't really suffer a lot of pain, so I forget to do them. Otherwise, I would probably do them every 6 months, but once a year would be pretty good too. So this fluid is just injecting right into the joint space. No pain at all, even for me. Not really feeling anything. I'm just going slow for no good reason, just to make sure I don't feel pain, but I could go quicker if I wanted to. That's one knee down, right like that. Easy, no problems. Try the other one, see if the other one goes just as well. So Christy has some more ropivacaine drawn up for me. The left one's actually the harder of the two for me to do, just because the lateral approach just goes a little bit more easily. So I'm going to go slow, inject as I advance the needle so I don't feel pain. This is how we do the intra-articular injections when we're doing a PRP stem cell injection too, by the way. And so the intra-articular injection of a knee joint treatment doesn't really hurt that much. It's really when I treat the tendons, ligaments, and meniscus, those are the structures that hurt more when I inject those. And we do have nitrous oxide available. Most people like to use that. I use that whenever I'm injecting PRP stem cells in my body because I don't like pain. That works very well to make that pain a lot less. All right, there's my HA for the right knee. Let's slip that in there. And we'll just pop that in. I'll go a little faster on this one. Whoop, I didn't put the needle on tight enough. It's my bad. I lost a few drops. No big deal. And just like that, we are done. How easy was that? So, that's going to lubricate my joints and preserve the health of my cartilage, which is always a good thing. A lot of people want to know, once we do a stem cell joint regeneration, like how long is it going to last? Well, it should last indefinitely. We don't know how, at some point it may start bothering you again. It's hard to say. I don't have to retreat knees or other joints very often for arthritis. The more common joints that I have to retreat, more common things that I have to retreat, something that I've already treated, would be tendons and ligaments. And usually it's younger people that are very active in sports that usually end up having an injury, re-injuring an area. And arthritis is one of those things that just builds up over time. It takes a lot of time to get. The tendon injuries can occur promptly right away, or ligament injuries. You can also get tendinitis and problems with the tendons over time. Tendinosis and tendinitis, very similar, what those two things are. But the longevity of how long this lasts, all I can say is it lasts a long time. I very rarely have to retreat people for arthritis, but I've been doing these treatments longer than any other doctor here in Utah. I've been doing it for about 10 years. And I know that some of the people I treated earlier in my career that had good results will likely come back to retreat the area if it ever started bothering them again. And sometimes people do, but the percentage of those people is very low because people just don't need to get retreatments. A lot of my patients that end up doing joint treatments with me end up doing other things with me too, like bioidentical hormones or other things that they have to come back on a regular basis. And so I am seeing these people constantly, and I'm getting feedback, and whenever I ask them, hey, how's that joint holding up? How are your knees holding up? Then usually it's been holding up for a long time. But I also give reassurances to my patients. If I ever have to retreat a joint that I've already treated with stem cells, I stand by it and I only cover my costs. The price is greatly reduced. It's not what the initial cost or the investment is to treat a joint. The follow-up treatments are always reduced, and I'm basically just covering my costs if I ever have to retreat a joint. Even if it's your own fault, even if it's not that the arthritis bothered you, even if you have an accident, a car accident, or I treat a lot of MMA fighters that do submission holds that are tearing joints. Regardless of the cause, if I have to retreat a joint that I've already treated before, I'm just covering cost on those repeat treatments. It's drastically reduced. But this is a type of simple thing that people could do for hips, knees, ankles, shoulders. We could put hyaluronic acid in all these big joints that have a joint space to just keep it lubricated and keep everything healthy for as long as we can so that we don't have to retreat.